The fatal drug overdose crisis is on the minds of more than half of Americans affected by substance use disorder. Although it takes a multidisciplinary approach to address this crisis, law enforcement and related professionals play critical roles. How do I know? My name is Steve Forzato, and I served in law enforcement for 33 years. For 28 years, I was undercover, posing as Tony Randazzo, a drug dealer, a drug user, as well as a gun and human trafficker. I traveled the country and the world learning about the harm caused by addiction. Alarmed by the rising numbers of fatal overdoses, I sometimes risked exposing my true identity when I warned students and parents in carefully selected presentations in schools. I know firsthand the harm caused by addiction and witnessed with my own eyes fatal and non-fatal drug overdoses. In my law enforcement career, I not only investigated drug trafficking, I also trained teams of investigators to hold accountable dealers whose drugs kill and doctors whose overprescribing addicted patients they had pledged to do no harm to. I worked on the nationwide civil investigation of Big Pharma that held opioid manufacturers and distributors accountable for their role in the American overdose crisis. I met with moms and dads who lost their children to overdose. Substance use disorder, whether alcohol, meth, cocaine, pills, heroin, fentanyl, and other substances, is a crisis that all communities face in all states. When I retired my undercover role as Tony Randazzo, I connected with Hazelton Betty Ford and Caring Treatment Center to learn more about treatment. They taught me, and later my care team, what I wish I had known when I started my law enforcement career. That is, substance use disorder is treatable, and I can become skilled in interventions, connecting people to treatment programs that work. Had I known earlier in my career what I know now, I could have helped so many begin to live their lives free from drugs and alcohol. I left the shadows of my undercover life and went public when I transitioned to academia at St. Joseph's University, where I directed Center for Addiction and Recovery Education. At CARE, I built a team of 34 that educates police and related professionals on addiction. Through our nonprofit, we have trained thousands across the United States, Canada, and the Caribbean. Research shows as audiences learn about addiction, they begin to see how they can make positive changes in their communities through their work. I often tell my audience to practice in their communities what I teach them, so that when they need to do an intervention at home or among colleagues and friends, they will do so with better skill and experience. Here at SJU, the Center for Addiction and Recovery Education stands ready to train prosecutors and police, corrections officers and probation and parole, children and youth, firefighters and EMS, and many other groups on the front lines of this crisis. Those we train unlock confidence in people in active addiction that change can, in fact, happen. Imagine every police officer in your region and state becoming a connector to treatment. How many lives would be changed for the better? How many would put down drugs and harmful alcohol use and pick up sobriety? That is our goal. SJU Care calls on department heads, elected leaders, public health officials, and other influencers to take us up on this limited time offer. We will train everyone on the front lines of this crisis. Email me at care@sju.edu and let me know how I can add to or supplement the work you're already doing to address substance use in your region or state. Thank you.